Thank you all for coming out today to the North Oakland Health Center on a topic that is really important to all of us in Oakland County, and that is the adverse impact on our public health through vaping. Yes, sir? Pull it down. All right. So first I'd like to introduce our speakers for today to you. Of course, I'm Dave Coulter. I'm the Oakland County Executive, but joining me today are Dr. Wanda Cook-Robinson, who's the Superintendent of Oakland Schools, Julie Brennan, who is the President and CEO of the Alliance for Coalition for Healthy Communities, and also Leanne Stafford, who's Oakland County's Health Officer, and she oversees our Health Division. So we know that e-cigarettes or vaping is a hazard to our public health, and we take that very seriously. They are, and this is shocking, but the most commonly used tobacco products now by our middle and high school students, and they pose a real and serious threat to our children. The percentage of our teens who are trying this addictive, dangerous product is much, much higher than teens who are using cigarettes. We've done a pretty good job as a nation in reducing cigarette use among our teens, but vaping now has the potential to erase those gains that we've made. And the tobacco industry, we believe, heavily advertises flavored vaporing products to young people using methods that were long ago banned when it comes to cigarettes. And during that time, there has been a nationwide increase in the use of e-cigarettes among our young people. Now, Michigan has also seen its first vaping-related death and dozens of vapor-related injuries. So Leanne is going to share some key details and stats with you in a moment, which I think will open the eyes of the public on just how bad of a health problem this really is. Dr. Cook-Robinson is going to tell us about how vaping is affecting schools across Oakland County. And Julie's going to talk about the community education and compliance efforts. And when she does, I want you to pay special attention to this map behind me. It overlays Oakland County schools with vaping and tobacco shops and shows the proximity to those schools. Now, this map doesn't even include gas stations and other stores that may sell vaping products, but it will give you the sense, as it has us, that these products are sold in areas where young people are sure to be, and we believe that that is no accident. But for our big announcement this morning, I'm really proud to talk about a coalition that we're helping to bring together to address this vital public health issue. Oakland County, through our health department, and one of the most serious obligations we have as a county government, our Oakland Schools, and the Alliance of Coalitions for Healthy Communities. We're going to align our efforts to prevent youth tobacco use, specifically vaping, by providing more education, advocating for changes in public policy, and creating a healthier environment for our kids here in Oakland County. By working together, we can tackle this serious public health issue and move the needle on how many teens are endangering themselves by using this perilous product. It's important and critical that we do everything we can to protect the health and safety of our young people. I believe there's no more vital role that a county government can play than this. And by the way, I would also add that Oakland County supports Governor Whitmer's state ban on the sale of flavored nicotine vaping products. I'm proud of her efforts to be the first state in the country to do this, which is now being taken up nationally through the White House. And I echo the statements of Dr. Caldoun, our Chief Medical Executive for the state of Michigan, about the need for increased regulation on these products, as the e-cigarette marketplace remains a largely unregulated industry in Michigan. So today, we want to specifically highlight the local actions that we're taking to protect the health and well-being of our Oakland County youth. And so with that, I'd like to turn it over to Leanne Stafford, our health officer for Oakland County, who will speak to the health concerns related to vaping here in Oakland County.
Thank you, Mr. Coulter. Vaping, particularly around youth or for youth, is a public health issue. The Health Division, in strategic alliance and partnership with Oakland Schools and the Alliance, is focused on continuing to align substance abuse prevention and education efforts to increase awareness of the harm of e-cigarette use and new and emerging vaping products, improve access to substance use dependent treatment services among youth. These efforts include providing substance use education, including specific vaping prevention education at no cost, creating educational media campaigns, like the ones you may have seen on part of the smart buses, and communicating routinely with legislators and regional partners. This work is a core value of the Health Division. As of October 8th, there are just shy of 1,300 vaping-associated lung injury cases reported across the country. 26 deaths have been confirmed in 21 states. Michigan had its first vaping-related death reported on October 2nd and currently has 35 confirmed or probable vaping-related lung injury cases statewide. Among Michigan cases, 13% are under the age of 18 and 80% are between 18 and 34 years old. This is predominantly affecting our youth and young adults. In 2017, 44.5% of Michigan high school students reported using e-cigarettes, which far surpassed the 31.3% of high school students who reported smoking traditional cigarettes. Most e-cigarettes contain nicotine, the additive drug in regular cigarettes, cigars, and other tobacco products. In fact, some e-cigarette products can contain as much nicotine as 20 regular cigarettes. Nicotine exposure during adolescence can harm the developing brain, which continues to develop until about age 25 and can impact learning, memory, attention, and increase the risk for future drug addiction. In addition to nicotine, the aerosol that is inhaled and exhaled from e-cigarettes contains harmful substances such as heavy metals that can be inhaled deeply into the lungs. The Center for Disease Control and Prevention's latest findings from the national investigation on these lung injuries suggest products containing THC, the psychoactive chemical in marijuana, play a role. Nationwide, cases are reporting using THC and nicotine, sometimes one, sometimes both. Among cases interviewed in Michigan, almost half reported only using THC, and about 20% reported just nicotine. The rest reported using both THC and nicotine. So far, no specific product or brand has been linked to this outbreak. With this information in mind, we advise residents to not use vaping products containing THC, consider refraining from any products or e-cigarette products, and immediately visit your healthcare provider if you have a history of vaping and experience symptoms such as shortness of breath, cough, chest pain, nausea, diarrhea, or vomiting. In general, youth and young adults and women who are pregnant should never be using vaping products. Never buy any vaping products off the street. Do not modify any vaping products, including those purchased through a retailer. Adults who don't currently use tobacco products should not start using e-cigarettes. Adults who are vaping should not smoke combustible cigarettes as a replacement for nicotine. Free help is available for individuals who are interested in quitting tobacco at 1-800-QUIT-NOW. The health and safety of Oakland County residents is always our priority. We look forward to working with our partners to address this important public health issue. Now I'd like to introduce Dr. Wanda Cook-Robinson, the Superintendent of Oakland Schools.
Good morning, and thank you, Leanne. And I also want to thank the Oakland County government and Dave for inviting us to be a partner here today. Last year in May of 2019, I was invited to participate in the Prescription Drug Safety Network Summit. Went to that summit, sat on a panel, and it scared the heebie-jeebies out of me. When I found out what our young people were engaging in, I knew I had to come back to Oakland County and look at what we were doing in our schools. We had reported cases, but we hadn't looked at it in the aggregate. When we did, we being the Oakland County superintendents, we found out that vaping is a major concern across our county. We've seen illnesses that are related to vaping climb, and especially among school children. Teachers and administrators are finding themselves at the forefront of battling this issue. We've received reports of children as young as 4th grade vaping. Now, we know we have to get some safety controls in place before this becomes an epidemic. But it becomes very difficult when we have manufacturers and advertisers who are targeting our children. For example, Johnny's Cream Puff, strawberry. My 4th graders think this flavor is cool, and when it comes in something that looks like a jump drive that I can just stick in my mouth when I'm walking down the hall, they think this is better than smoking. Another product, and this one is called Fruit Monster. Now you heard of Cookie Monster? Fruit Monster. Mixed berry. We also have peanut butter and jam monster. And for our adolescents, we have Sad Boy here. Looks very cool and very attractive to our middle school students. In addition, these products are very easy to get. We have been told, it's been reported to us, that you can get these vaping devices from Amazon. And if you have Prime, you can get them in 2 days. Any flavor that you want. Oakland Schools and the Oakland County Superintendents know that we have to play a critical role in promoting health and safety, and most importantly, educating our students to the dangers of vaping. That's why we at Oakland Schools have adopted the Michigan Model for Health curriculum, which teaches strategies on not just how to say no, but how to avoid getting involved in using the device and the tool. Vaping is prohibited on all school property, and if students are found to be engaging in this behavior, they are dealt with according to district policies. We also know that we're going to have to provide more resources and more help. So what we have done is to create a module of training that we can provide to all of the local districts that will help them in terms of delivering this education. We have training for school staff, including health educators, administrators, and mental health professionals. We have training on ways to integrate this vaping education into your existing curriculum when you're teaching about tobacco and drug prevention. And we also share with the state and community partners resources for parents, such as connecting them with My Life, My Quit, and other tobacco-related support. This is a very, very serious issue for us, and it will truly take the Oakland County village to find a solution here. So Oakland Schools is pleased to be here this morning and to join our voice with the resources and the support of this partnership. We look forward to working with the coalition. Thank you. At this time, I'd like to introduce Julie Brenner, who's the director of the Alliance of Coalitions for Healthy Communities.
Thank you and good morning. The Alliance of Coalitions for Healthy Communities has specific prevention efforts that were funded through Oakland Community Health Network that take place across Oakland County with our 19 prevention coalitions. That includes coordinating and facilitating a regional vape work group, offering free school presentations through our Keep Them Safe, Keep Them Healthy school programming. which over the last 2 years, we've been hearing quite a large uptick within our focus groups about vaping. We recently distributed an electronic nicotine device school administrator prevention handbook to all middle school and high school principals. We participate in the state of Michigan's ENDS community work group. We teach and facilitate a vaping social norms campaign with Oakland Technical Schools. And we provide every Oakland County school with drug-free zone signs that includes prohibiting the use of vaping. We have also created important educational resources, such as the toolkits we provided today that are targeted at parents, grandparents, and caregivers. We have a media campaign, including billboards and social media posts about the dangers of vaping, in addition to promoting the state's My Life, My Quit cessation program. I also want to take a moment to highlight our work with the SINAR program. This program aims to decrease youth access to tobacco. Our alliance of coalitions, the 19 coalitions, meet with over 500 tobacco retailers and educate them on the law. Our staff, in partnership with local law enforcement, conduct annual compliance checks that are random and unannounced to determine if they are abiding by the state law, which prohibits the sale or distribution of tobacco products to individuals under the age of 18. To date, there are over 750 retail tobacco outlets in Oakland County, and the majority of them sell vape products. Enforcement programs like this are especially important when taking into consideration tobacco retail locations and their proximity to schools. And I definitely encourage you to take a look at this map that shows you that how it blankets the entire county and how close they are to our children. In the future, the Alliance looks forward to collaborating more with Oakland County Health Department and Oakland Schools, increasing our free vaping prevention presentations to all the schools across Oakland County, beginning our Partnership for Success grant-funded work on geomapping to address social norming, working on geomapping and social norming initiatives that are focused on, again, increasing vaping prevention. In closing, it's especially important to note that help is available for teens who want to stop using tobacco products, including electronic cigarettes and vape. The new My Life, My Quit program is especially created for teenagers and offers them the option to text or call a toll-free number, which is 855-891-9989. They can also visit the mylifemyquit.com website for real-time coaching. Thank you, and at this time I will bring Mr. Coulter back.
Well, I mean, at this point, I think I'd like to thank you all for coming out and helping us to highlight this really critical and important health issue. I invite our speakers to come back, and then if there's any questions, excuse me, that you have for us, we'd be happy to answer those now or afterwards. Your choice. Are there any questions for us now?
I guess more of a medical question for you. Can you compare how bad this is versus cigarettes? Which one's worse? How much worse?
No, I think as we continue to see the data out there, we'll know more. But, again, the e-cigarettes can contain up to, one e-cigarette or vaping device could have, up to 20 cigarettes. So it may not be worse, but it's the level and the amounts that our children and our youth are getting, and even adults, that they may not be aware of what's actually in that device.
I guess this is a question for really anybody. How do you think this has been able to go so far without so little regulation?
Sure. I think part of it is, if you can take a look at what we have on the table here, it's hidden. Most children or youth that are using, it was originally created to stop using tobacco, a cessation tool. What's happened is, especially with what Dr. Cook was displaying, it's targeted at children, and that's part of the problem, is having all these vape juices and special flavorings that have absolutely nothing to do with cessation. So there's been a drastic increase. Has been very, very easy to hide for kids. They're doing it in school. They're doing it right in the classroom, and you wouldn't even know that it's happening. So that's part of the issue, making sure that that's being decreased. At the same time, we are thrilled with what Governor Whitmer has done about the flavoring ban, because we think that will take it off the shelves. but then that could also create additional problems that we'll address as they come up.
And Dave, you had mentioned that you were interested in some changes for policies. What specifically would you like to see?
Well, the flavored ban was a great first step, but we're going to continue to work with Dr. Khaldun and the state on and our partners on other policies that we can do. Part of the problem is that this is a largely unregulated field. We're only beginning to now understand the magnitude of the problem. The FDA only last year began to restrict some of the marketing that's used, marketing that we do not allow for cigarettes. So we need to look at the marketing, the way this map helps us understand exactly how it's targeting our young people. And I don't have a specific policy, but those are going to be the general areas that we need to get on top of and regulate it like any other product that is dangerous like this one.
Can anyone speak to the level of compliance with the retailers in Oakland County of keeping this stuff off the shelves since the ban?
Sure. So that's part of our SINAR. I know that for this coming SINAR year, that they will be addressing vaping within the education that we do. So again, with over 500 education kits that go out, and we actually go into those stores, that will be added into the package to make sure that they're being compliant, and then we do those checks as well. So I would be happy to report by next year that we'll have a little more data on that.
So the rollout is just beginning right now.
For vaping, yes. So currently, I know that it's out, most of the retailers would have some of that information already. I know that the kids are very aware of it, and making sure that they're being blocked from going into those locations to purchase.
When we talk about proximity, I mean, how close are some of these vaping retailers to schools?
A block or two from the schools. There's no question that these vaping stores are targeting our school areas. Within a couple of blocks is where they're at. And the other point, to get to your last question, is this is really an emerging health crisis in our county. And so we're really just getting our heads around it. Kids, as usual, are ahead of the adults in terms of these sort of things. They've known about this for a lot longer than we figured out that this is a real problem. Dr. Cook Robinson's comment about just sort of being exposed immediately. We're all sort of beginning to understand the magnitude of this, and our kids already know about it. So it's one of those things where if we're going to keep our kids safe, we've got to be as educated and ahead of where they're at. And so this morning's effort to combine our three organizations to address this is just the beginning of what's going to have to be a long and sustained campaign to make sure that we keep our kids safe.
Question for the superintendent. Do your students know how harmful this is, or do they not care?
My students think that this is a better alternative to smoking. As Dave mentioned earlier, we've done a good job about letting students know what the danger of smoking is, but they do not connect that this is nicotine and that one joule is equal to 20 cigarettes. That's what we're trying to educate them on. They walk around all day. Think about it, something that small, you drive, put it in your mouth, and hang out the rest of the day. We first had to educate our teachers as to what that was and what to look for, because students were doing it right under our noses. So they don't realize that this is even worse. And that's the education and training that we're joining with our partners to do.
So what's the best advice you can give parents that may have concerns about their children and using these products?
That is a great question. First, parents have to be diligent. You've got to make sure that you have your eye on your students. Also, you have to watch for signs. Nicotine is a drug. So when students are, vaping, they tend to have shorter breath. They tend to be a little more, less energetic. You have to know your kid. For example, young man, if you were my son, I would know exactly when you were vaping, because you look how smiling and energetic you are. If you were walking like a little bit down, if you weren't watching TV, you weren't playing your video games, I would say to my husband, we better check this kid out. Something is going on. Parents have to be diligent in observing their students. And if you know your students, then you'll know when there are changes. And those changes are what you look for.
What was the reaction of teachers when you started to inform them what to look for? Did they notice that, wow?
OMG, oh my God. That's what teachers said. They couldn't believe it. And as we started to talk with them, they start saying, think my fifth graders are vaping. I think I had kids vaping the other day. They didn't know. We had to do education to let them see what the devices looked like so that they could recognize it. Many of them, you know, particularly among adolescents, when adolescents have behavior change, you know, is it vaping? Is it because they're adolescents? Is it teenagers? That kind of thing. So they were slow to recognize it until we pointed out, first of all, what the device looks like, and second, look for change in behaviors. But they were terrified.
I know this is relatively new, but any data yet on long-term effects?
No, I mean, again, it's very similar to, you know, that, is it an addiction thing? So again, as Mr. Coulter discussed, this is fairly new, right? And so we're just starting to see these cases come forward and the lung injuries that we're seeing in the cases. So we will be following up and, you know, providing data as we receive it and sharing it again with our collaboration here as well as our regional partners and the community.
I've heard Celia said that most of the injuries or the problems that have come up, hospitalizations, have dealt with THC products. Is that true, or is?
Yeah, we're seeing, you know, a large majority have used THC, but we're also seeing those that have just used nicotine or reported that they just used nicotine, and we're seeing some that are that have used both. So yes, that statistic is there showing that a high amount of individuals that the lung injury is happening to, we're using THC.
We're good? All right. Thank you so much for being here and helping spread the word. Appreciate it.